Assalamualaikum warahmatullahi wabarakatuh. I bid to our respective lecturer, Dr. Madia. My name is Fatih binti Muhammad Asri. Along with my group members will be Fadilatu Fazira binti Muhammad Nisfu and Fatih Adriana Fikri binti Muhammad Tirmizi will be presenting on our presentation titled Descriptive Epidemiology of Prostate Cancer. This is our table of contents, which includes introduction, background of disease, descriptive epidemiology, and conclusion. Next, for the introduction, there are definition and symptoms and the introduction. Firstly, the definition of prostate and prostate cancer. So what is prostate? Prostate is a part of male reproductive system, whereas prostate cancer is a condition where there is a growth of cancerous cells on the prostate. These are the symptoms faced by the patients, which includes trouble urinating, frequent urination, decreased force of urination, difficulty starting and stopping urine stream, and lastly, pain and discomfort in pelvic area. Next, the background of disease. Firstly, for the causes or etiology of prostate cancer, the causes is actually unknown and not well established. However, based on previous studies, they found a few main risk factors such as advanced age, ethnicity, genetic factors, family history, diet, obesity and physical inactivity, inflammation, hyperglycemia, infection, and environmental factors. Next, for the incidence and mortality rate, there's a 7.1% incidence rate worldwide, and for the mortality rate, Africa marks the highest mortality rate, which is 124.4%. Next is the control measures of the disease. Firstly, there's a limitation in high fat foods intake. Next is increased intake of vegetables and fruits, increased exercise, perform screening especially for men aged 44-year-old and above, and lastly, perform prostate specific antigen PSA screening for men aged 55 until 69-year-old. For the significance of the disease, prostate cancer is said to be has low risk in mortality compared to other cancer. Based on previous study, it shows that majority of the patients has high survival rate. Furthermore, early detection of cancer may contribute to the increased chance to survive from this cancer.
Next, I'll be talking about the descriptive epidemiology of prostate cancer across the globe in terms of regions and age standardized rate. So in the US, the incidence rate has decreased by 6.5% per year since 2007. So several studies have associated the decline with the routine PSA testing recommendation by the USPSTF or the US Preventive Services Task Force, which is an independent body consist of national experts in disease prevention. The US also experienced a decrease in mortality rate by 4.3% since 2012. In Africa, they have the highest incidence rate of prostate cancer in the world, and there has been an estimated of 104% increase in mortality rate by 2030. It is presumed because of the developing countries, the limited amount of screening done to detect the disease in its early stage, and the theory that the proximity to the US and the associated influence of westernization might as well influence the mortality rate. In the UK, the PCA incidence rate increased almost threefold in between 1981 and 2011. However, in a cohort study, the Afro-Caribbean men residing in the UK had the highest incidence rate, with 3 times more likely to be diagnosed with the disease and were diagnosed approximately 5 years earlier than UK Caucasian men, despite having equal access to diagnostic service. However, the mortality rate in the United Kingdom remains plateau until 2000. Then we have the other European country. The PCA incidence rate increased in 4 from 5 Nordic countries, and the mortality rate in Central and Eastern Europe also increased. In Caribbean, the information of prostate cancer incidence rate, risk factors, and public health implications for Afro-Caribbean men is sparse and inconclusive. The reported incidence rates for Jamaican men is contradicted with the recent data, While disparate and confusing incident rates have been documented for Barbadian men. However, Trinidad and Tobago has among the highest mortality rate in the world, with an increasing average of 4.5% per year over the past decade. It is theorized that because the Tobago prevalence rate may have been associated with a high biopsy rate. Similar to most developing countries, there's a lack of biopsy materials and histopathologists, few cancer registries, reliance on hospital-based instead of population-based sampling and screening for prostate cancer is not prevalent among this group. In Asia, the PSA rates have increased in some Asian countries such as Japan and China, even though PSA testing is not often used. It is believed that westernization of lifestyle, reduced physical activity, and increased consumption of fat may be the major contributors. In fact, 2% of all cancer-related death in Asia-Pacific region is from prostate cancer. Next, we move to India. The incident rates have increased over the past 2 decades. And the mortality, however, the mortality data is not available for India. Then we have the Oceania, which the prostate cancer was the most common male cancer in many parts. In fact, the mortality rate in Oceania is 6 times greater than East Asia and 3 times greater than Southeast East Asia. In America, the incident rates of prostate cancer increased from 1993 to 2002 in Colombia, Costa Rica, and Ecuador, but in Brazil, it remained relatively high but stable in more recent years. Next, I'll be talking about the age standardized rate, which is a summary measure of the rate that a population will have if it had a standard age structure. So as we can see here, the ASR per 100,000 people was highest in Oceania, followed by North America and Europe. In fact, prostate cancer incident increased with age. So next, you can see the map showing estimated ASR incidence rate for prostate cancer worldwide in 2018 in males, including all age.
Next, I will explain about the association between ethnic backgrounds and prostate cancer. There are significant differences in prostate cancer incidence and mortality rates across the ethnic groups. So first, I will explain about the incidence rates. In the United States, it can be observed that African American men have a higher incidence of prostate cancer compared to other racial and ethnic groups, while the lowest incidence rate is observed in American Indian, Native and Asian, and followed by white population. This disparity between the ethnic groups can be due to the differences in social, environmental, and genetic factors. For example, it is reported that African American men are less likely to receive assessment or treatment, which may increase their risk of disease progression. Next, lifestyle changes due to migration also may influence the prostate cancer cases. For example, prostate cancer incident and mortality rates increase among men who migrate from low risk to high risk countries compared with those in their native countries. Moreover, several studies suggested that genetic factors may play a role for some differences in incident rates, such as mutation of chromosome variants, variation in genes for tumor suppression, and cell apoptosis that commonly found in African American men, which have been shown to be associated with increased prostate cancer risk compared to other ethnic groups. Malaysia is a high middle income country in Southeast Asia, having a multi-ethnic population, mainly Malay, Chinese, and Indians. Based on the Malaysian National Cancer Registry Report 2007 to 2011, the highest incident rate was found in Chinese, followed by Indian and Malay. However, a recent cross-sectional study found that the Indian groups was the highest percentage of prostate cancer cases. So the changing in prostate cancer trend may be influenced by the difference of detection tools used to identify the prostate cancer. Next, for the mortality rates, based on the recent trends in United States, mortality rate between 2001 and 2015 showed that the decline in mortality in African American men was greater than in white men. It can be observed that the advancement in diagnostic tools and improved treatment may contribute to this trend. For the prostate-specific antigen testing, the differences of incident and mortality rates among the countries is not entirely well understood. However, the practice of PSA testing may contribute to the world variation in prostate cancer incident rates. For example, studies showed that the reported prostate cancer cases in the United States and Europe could be due to the overdiagnosis of extensive PSA testing. On the other hand, underdiagnosis, unreported cases, differences in screening practices, Differences in healthcare access, gaps in knowledge and awareness, and attitude toward prostate cancer and associated screening may also influence the variation of incidence and mortality rates in many countries. Therefore, in conclusion, prostate cancer is the most common malignancy in men. Therefore, further understanding about the incident cases and differences between stage, race, or ethnicity and age can help to guide public health planning related to screening, treatment, and survival care. That's all from us. Thank you.